Welcome back, and now for our story. The Healthcare Sierra Leone, USA, has met with local medical practitioners to discuss on chronic disease and addiction disorders in the country. The aim was to raise awareness on the increase in chronic diseases and substance abuse among young people in particular, and how to address them. Joseph Toure witnessed the event at the FCC auditorium.
This gathering of both Sierra Leone medical doctors living in the USA and in the UK was to chat on strategies in addressing chronic disease and addiction disorders in the country. During her presentation, keynote speaker Dr. Nelly Bell indicated that chronic disease and addiction significantly impact the health and well-being of citizens, presenting substantial challenges to the nation's healthcare system. She also told the gathering that studies have shown that the increase in substance abuse is prevalent among youth between the ages of 20 and 29. Chronic disease, she went on, is a visual cycle, and there is a treatment gap in responding to it.
We should concentrate on the first 1,000 days of life, so the pregnant woman and the child up to 2 years of age, to be able to break that vicious cycle. And also we need to have a holistic approach to prevention of addiction and chronic diseases.
Chairman Healthcare Sierra Leone USA, Dr. Michael Pierce, said the institution will continue to support the prevention of chronic disease in the country. He said they were committed to give back to their motherland through education and providing healthcare services.
So we want you to know that our goal is to continue with education, so that we can be able to prevent all these chronic illnesses that are occurring in this country. Because though we are all specialists in our areas, various areas, we do believe that preventive care is the key to good health, not only in Sierra Leone, but in the world at large.
During a panel discussion, medical experts said there was a need to focus on malnutrition among children to prevent chronic diseases. They also noted peer pressure has been a cause for substance abuse among young people. An appeal was also made by the practitioners to treat mental health issues with all seriousness. Most importantly, they said, children should be educated on such issues and structures be put in place to treat addiction and mental health issues. Responding to the concerns on chronic diseases and addiction disorders among other health issues, Deputy Minister of Health 1, Dr. Charles Senesi, said government was committed to address the situation.
As a government, we are very much concerned, and we are dealt with this when it all started by making sure that the pharmacy will analyze the psychoactive substances that are used, especially push. So let's also water the content of it as well, and we'll put that analysis done. Even before we as a government took it as a really public health emergency, which we declared. And we have to put a lot of infrastructure, which I will delve into later in the symposium. But as a government, we have taken strong leadership for this particular impact of our country.
At the end of the session, one thing that came out strong was that chronic diseases and addiction disorders are not only medical issues, but they have both social and economic impact on Sierra Leone. SLBC, Joseph Toure reporting.
Step in improving healthcare in the nation, the partnership comes with an endorsement from the Ministry of Health, which has pledged $3 million worth of equipment and medication to support these initiatives. Dr. Michael Pierre, Chairman of Healthcare Sierra Leone, emphasized the importance of understanding the limitations faced by the hospital staff and identifying their specific training needs.
Tell us, these are the basic things we want, and this is what and how we're going to use it. But I want you to know that teaching is what we want to look at.
As part of their commitment, Dr. Pierre handed over essential medical equipment, including a handheld ultrasound machine, EKG blood pressure machine, and other vital tools to support patients' care.
So that the infection, transfer of bacteria will be minimized.
Hospital Care Manager Dr. Mark Kapua expressed gratitude for the support. stating that they are more than prepared to accept the Healthcare Sierra Leone team and look forward to their expertise, highlighting the readiness of Connaught Teaching Hospital to integrate these resources into their operations.
Biggest problem, we do not have the equipment, we do not have the supplies. So it will be very difficult. So even with all the ideas that you have, with all the experience that you may have, you may unfortunately stand by and see a patient dying. We have really smart healthcare workers who, like most of these things you're saying, most of my colleagues may not even have had the opportunity to see them. But once you come with them, you teach them for a day or two, I will tell you, the next time you come, you meet them using it, once they have it.
This marks Healthcare Sierra Leone's fourth year in the country, where they've made significant contributions not only in training but also by supplying food, equipment, and medical expertise. The team, comprised of Sierra Leonean medical professionals based in the United States, is dedicated to uplifting their homeland's healthcare system.
We don't come to change anything, but we come to augment what is already going on and bring in our expertise, work with what's already here to make the services be best practice.
Dr. Eva Hansels, consultant and anesthetist, also joined the conversations, advocating for the establishment of unit accounts for donor funds to streamline access for immediate needs. She pointed out the urgent requirement for training nurses in emergency care, as currently only 2 nurses possess such qualifications.
We want to train our nurses in emergency medicine. Right now, we only have 2 trained critical care nurses, and only one of them is working in the ICU. I would like to have those trained. We've just taken receipt of lovely equipment, but we would like them to know what to do with the equipment, when to use this equipment, to know the physiology. Now, we don't offer that course here.
The ongoing efforts by Healthcare Sierra Leone are crucial in transforming the healthcare landscape in Sierra Leone, paving the way for improved health outcomes and access to quality care. As this partnership opens out, the hope is that it will lead to sustainable improvement in the healthcare system, ultimately benefiting the people of Sierra Leone.
Healthcare Delivery Symposium in Freetown. The chairman of Healthcare Sierra Leone, based in the United States of America, Dr. Michael Pierre, has announced donation of medical supplies worth over $6 million to the Ministry of Health. The symposium was part of the organization's mission to contribute significantly to the improvement of healthcare delivery in the country, as well as support the Ministry of Health to reduce infant mortality through Rotary International Support Help Babies Breathe training programs. Here is the report. Organized by Healthcare Sierra Leone USA in partnership with the Ministry of Health, the Symposium on Healthcare Service brought together the country's medical doctors, nurse practitioners, and nurses from the United States of America to share insights, best practices, and collaborate with local professionals to enhance the healthcare system in the country. The move is to contribute significantly to the improvement of health service delivery, especially in hard-to-reach rural communities. Chairman of Healthcare Sierra Leone USA, Dr. Michael Pierre, said he was excited to be in Sierra Leone for the organization's second annual 2024 medical mission, stating his team is ready to collaborate with local healthcare professionals, share knowledge, and provide vital services to the poor. He said the tireless efforts of the country's doctors, their compassion and expertise have been a beacon of hope for countless individuals and families in time of illness and distress.
Today, Mr. Minister, I want to pledge our unwavering support for what we have done and we are going to continue to do. At the end of this program, we want to donate to the Ministry of Health a total of about $6,550,000 worth of medications.
Dr. Pierre described the gathering as a testament to their collective belief in the power of humanitarian work, power of the community, and power of health care.
We have patients going to even our emergency room. There is no basic equipment to help them make diagnoses. They are very knowledgeable, the doctors here, but they are lacking with deficiency in the equipment that can help them to make the right decision.
Deputy Minister of Health 1, Minister of Health, Dr. Charles Senesi, lauded the Healthcare Sierra Leone USA for their continued support to the health sector and underscored the need to improving the healthcare delivery for low and middle income countries, with Sierra Leone being no exception.
Then comes the challenge of mobilizing resources, human, material, and financial. But whatever you do, I say always have it at the back of your mind that you are coming to complement the effort of those on the ground.
In addition to the symposium, the medical team will extend its reach to Moyamba District and Buretown in the Western Area Rural District, providing essential healthcare services to indigents in these communities. And the Help Babies Breath training will also be conducted in Moyamba as well as Matrujon, Bo and Freetown to further demonstrate Healthcare Sierra Leone USA commitment to making a positive impact on the health and well-being of the communities it serves.
On behalf of the MOHS and the NMSA, I want to thank Healthcare Sierra Leone USA for this donation for the people of Sierra Leone. And I want to assure on behalf of the NMSA team that this donation will be fully utilized for the intended purpose of the people of Sierra Leone. And once again, I want to thank Healthcare Sierra Leone for this kind gesture to the people of Sierra Leone. Thank you all.
And we can witness who the healthcare Sierra Leone USA, they can donate medicine them and treat people where get different sickness them. Well, today we didn't have the Kono government hospital, we see so many doctors them, we see so many nurses them from different diaspora and from and they also for treat people them, and they also for distribute the medicine them more than say they count for the Kono people them. So and they are with my own colleague when NCO, or they also today for life coverage. When I see Kono and within a Koidu government hospital, we don't reach now the hospital. Now this is the hospital, and we come with healthcare Sierra Leone USA. We can distribute medicine them and we can treat people them. We get hypertension, diabetes, and we get so many doctors them. We come America. We come pledge them support and come for give back to the people of Sierra Leone. Today we didn't have Kono city, and this is not Koidu government hospital. And plenty how people pack na the Koidu government hospital just for can get the free medication and free medicine. We tell us say the healthcare Sierra Leone USA don't come for we and don't come for the people of Sierra Leone, and they don't go always stop the charity things that they do na Kono district. They never go na all districts them, and they don't they do this thing here. They don't do them na Loko, they don't do them na Buga Beach, they don't do them Moyamba, and today they na Kono district. So many people as you see, can turn the camera so you see people. So many people come, elder people come for can get these benefits here, and they patiently wait as the doctors them and the nurses them they attend to them. God bless you all. God bless you all.
Papa God, thank you. Tell her, thank you. Tell her, tell Papa God, thank you. Waiting room for me, we go tell. wetin do for me. We go tell am thank you. Tell am thank you. Tell am that Papa God thank you.
So you got a few words for say to the group?
Well, group, thank you very much. Thank you for coming with me to my hometown, Koidu town. We all don't work very hard. I guess we have a few more hours to wrap this up, so we are all going to work as a team for see people them as fast as possible. Triage run at the starting pharmacy or medicines that will come out and help so we can triage them faster and see everybody so we can be on the road back to Freetown faster. Now, thank you. People that wake up, we'll go try for you now as soon as we can. When I just be patient with me, okay? Now, thank you to everybody. All man and they give you number where you go pharmacy, you go discharge, just hold that number now all the way to the end. We're doing the names and numbers.
Dr. Duboya, you get something for say too?
Just for it, we need to thank everybody who come because this is a voluntary association or voluntary. It's a humanitarian, that's what the Lord described it. It's a humanitarian organization. We are not doing it for ourselves, we do it for others. So when we don't come, we tell them thank you for coming. Again, as they say, we get for the patient. But again, when somebody they talk to the nurses and the doctors them, we make sure say we keep on a distance because it's privacy. If people they see around them go afraid or they will shame for talk. Sure. So we want them talk, let them tell me exactly what to go with them so that we will treat them. So if we tell them I say we wait till that, that's the main reason that day. So if we do that, we will come here quickly. All right?
Okay. Yes. So you're going peace?
Yes, before we go, please.
1 minute.
We serve na a team now, we na staff of Jericho. Definitely when I sabi the in and out of our house, we need to take you around. When I get out, when I want to go somewhere in the restrooms, when I contact one of we for this.
Thank you.
And definitely for let the patient themselves able for pen them way to inside the consulting rooms and the pharmacy, they will need somebody to lead them there. So whatever you need, we are available.
Thank you. Thank you.
What's your name? Teresa.
All right, go in peace and do the work of God.
Thank you. Thank you. People come for can benefit from this medication, the free medication and that of this medicine here. As you see, all corners of the hospital and people in there, all corners. Yeah, now outside with Chairman there, we now Dr. Pierre. We also take care of some sick people. You see him? It's a great Dr. Pierre.
Yeah. I look at the report of the eye. The scan, you understand? One organ in there will explain down in malaria and things like that. Yeah?
This is the hard-working chairman for the healthcare Sierra Leone USA. We now Dr. Pierre talk to the patient and they attend to them, advise them how to take the medication. How you feel like where you don't get the medicine here? Zero thank you, right? So when are the message where you get for the healthcare Sierra Leone USA? Which message you get for them? Tell them plenty, thank you. Okay, thank you. So this one are you or the pressure or the hypertension? So you don't glad in that way you don't get your medicine? Okay. Now one of the beneficiaries in this we don't get your medicine now. Let's see Dr. Pierre. I just they're looking, mommy. Mommy, come to you. Yes, one child.
Okay, well, which one are the patients?
Okay, no problem.
If you take one, and one man in, but you know something, if you take two, but you guys start with the one for C, how the one in the food. Yeah, you take the one in the morning, They take one in the evening. If you need to extra paracetamol, you take a one. When they take the medicine, I'll go what sound. They're not supplying you with the supply. Why not this? Because you don't manage it. We just add this get one more. Okay.
Take a picture. I'll take a picture with you. Then patient. Okay. One chair. Fellow Sierra Leoneans, we dey watch we both home and abroad. Today at the UMC hospital. This is the Healthcare Sierra Leone USA in collaboration with the Ministry of Health. Today we come UMC hospital inside Kono district for can distribute free medication and free medicine to the people of Kono. This na the pharmacists them we dey prescribe medicines them for the people them we sick. We get different health challenges and where they go to. So this is one of the units then.
Huh? Yes, I have. Here we go. Okay,
yeah, that's the fee for the initial registration. Now we need for the international number. I would say, it's going to be a domestic affiliation with the international. But again, it depends on what you and the international. The international is 2,000.
I just well, now I go inside the patient and there waiting the wait as in they in the triage units. Well, this few of the patients them waiting the wait for get medication and free medicine from the Healthcare Sierra Leone USA. And some other people in Dinado, they wait for let them get their own card so they go enter here. This is the Healthcare Sierra Leone USA within Kono district, and today we dey at the UMC hospital. See how people in plenty, and not only this, other people in Dinado, they wait.
Then sharp box them. Yeah.
Call the next person. Daddy K. Yeah, now the trousers make good with one.
Next person.
Yes, come, Mama.
We're in a hospital outside the healthcare center. People in there. Well, fellow Sierra Leoneans, today within the Jericho Hospital, outside the healthcare Sierra Leone USA, can give free medication and free medicine to the people of Kono. Well, today is the last day, and the last day within the Jericho Hospital inside Kono District, inside Koidu City. Yeah, now the pharmacy, outside they can give the medicines. Outside the doctors and where they go down prescribe the medicine, and they are at the pharmacy where they can give them the medicine. Now we go down outside the doctors and they where they prescribe medicine them for the patients them.
This mommy don't come outside.
Dr. Pierre there? Dr. Pierre?
Huh?
Dr. Pierre there?
No, Dr. Pierre.
I'll take a short video. Just a video, no more.
Next person, yeah?
Next person.
Okay.
Next person. I write down medication
Remy.
and tablets.
Remy. You don't know you are.
What you need? Rice, okay? You also get your sauce, for example, groundnut.
Okay, thank you. Most of the doctors in there. Now we go back inside the pharmacy there. The doctors in there prescribe the medicine for them, and then they come up now the pharmacy outside they can give them the medicines. Well, we don't reach now the pharmacy. We see these are the medicine we put on the table.
Go to doctor for
we then for give to the patient. Well, families are waiting healthcare they do for the people of Sierra Leone, and they're not only there in a salon, they're going to go all sides of the district them, not to only Kono.
Oh, this one was not filtered.
How gonna do that?